Tuberculosis in ancient Egypt. The silent plague of the Nile. In the annals of medical history, tuberculosis, TB, stands as one of the oldest and most enduring diseases known to humanity. Its presence has been documented across civilizations, leaving an indelible mark on societies through the ages. Ancient Egypt was no exception to the ravages of this silent plague. Through a journey into the sands of time, we unravel the enigmatic presence of TB in the land of the pharaohs, exploring its causes, manifestations, and the rudimentary cures attempted by ancient healers. Before we go any further, please take a moment to like and subscribe to this channel. The silent plague, TB, caused by the bacterium Mycobacterium tuberculosis, has long been a scourge on human health. Its insidious nature, characterized by a slow progression and diverse clinical manifestations, often made it a silent and deadly adversary. In ancient Egypt, where life revolved around the fertile banks of the Nile, TB silently stalked the populace, leaving its mark on both the wealthy elite and the common laborer. Manifestations and diagnoses. The medical papyri of ancient Egypt offer tantalizing glimpses into the understanding and management of diseases prevalent in that era. Among them, TB finds mention in texts such as the Edwin Smith Papyrus and the Ebers Papyrus, albeit under different names and descriptions. Ancient physicians referred to TB as consumption, or phthisis, describing its symptoms of chronic cough, weight loss, and debilitating weakness. Diagnosis in ancient Egypt relied heavily on observation and inference, as the tools of modern medicine were yet to be developed. Physicians, known as SWNW, or SWNWNCR, would meticulously examine patients, noting the characteristic wasting and cough associated with TB. However, without the aid of microbiology or imaging techniques, diagnosis often remained speculative, with TB frequently conflated with other respiratory ailments. Causes and beliefs. Understanding the causes of TB in ancient Egypt requires delving into the prevailing beliefs and medical paradigms of the time. Ancient Egyptians attributed diseases to a complex interplay of natural, supernatural, and divine forces. TB was thought to arise from imbalances in the bodily humus, with predisposing factors including poor hygiene, malnutrition, and exposure to noxious fumes. Moreover, TB was often intertwined with religious and cultural beliefs, viewed as a punishment from the gods or a manifestation of spiritual affliction. Remedies ranged from incantations and offerings to deities such as Thoth, the god of wisdom and healing, to more pragmatic interventions aimed at restoring bodily balance. Rudimentary cures and treatments. In the absence of modern antibiotics and medical technology, ancient healers relied on a repertoire of natural remedies and ritualistic practices to combat TB. Herbal concoctions infused with plants such as garlic, honey, and opium were administered to alleviate symptoms and purportedly combat the underlying infection. Inhalation therapies involving aromatic herbs and resins were also employed to soothe the respiratory passages. However, the efficacy of these treatments remained dubious, with many patients succumbing to the relentless progression of the disease. As TB exacted its toll on the populace, it became entrenched in the fabric of Egyptian society. Conclusion: the specter of TB loomed large over ancient Egypt, leaving an indelible imprint on its medical history and societal consciousness. Despite the limitations of ancient medicine, healers endeavored to confront this silent plague with courage and ingenuity. Through a blend of empirical observation, spiritual belief, and herbal lore, they sought to alleviate the suffering wrought by TB, albeit with limited success. As we reflect on the ancient struggle against TB, we are reminded of the enduring resilience of the human spirit in the face of adversity. While our understanding and treatment of TB have evolved immeasurably since the time of the pharaohs, the lessons gleaned from ancient Egypt continue to resonate, underscoring the timeless quest for healing and hope in the midst of disease and despair.